cardiac cycle is a series of events that occur from the beginning of one heartbeat to the beginning of the next. Cardiac cycle can be divided into two main parts: systole, which is when the ventricles contract and pump out blood, and diastole, which is when the ventricles relax and fill with blood. The cardiac cycle graph is used to express the events during one cardiac cycle. In this diagram, along the y-axis are aortic pressure, left ventricular pressure, and right atrial pressure, ventricular volume, ECG and heart sound, while along the x-axis is time. Since there is no valve separating the right atrium from the superior vena cava and jugular veins, jugular venous pressure is the same as that of the right atrium. If the heart rate is 70 to 75 beats per minute, each cardiac cycle takes about 0.8 seconds. In this video, 7 phases of the cardiac cycle will be discussed. The first phase is the atrial contraction, which lasts about 0.1 second. The next 3 phases are isovolumetric ventricular contraction, rapid ventricular ejection, reduced ventricular ejection, which occur during ventricular systole, and last about 0.3 second. The last 3 phases are isovolumetric ventricular relaxation, rapid ventricular filling, and reduced ventricular filling, also known as diastasis, which occur during ventricular diastole, and last about 0.4 second. Atrial contraction starts when electrical impulse starts from the sinoatrial node and depolarizes the atria. On the ECG, atrial depolarization corresponds to the P wave. When atria contract, the pressure within atrium increases and pumps blood into the ventricle. An increase in the right atrial pressure is seen as a wave. The ventricular volume and ventricular pressure also increase slightly. In some conditions such as ventricular hypertrophy, the fourth heart sound, S4, can be heard during atrial contraction phase. Fourth heart sound is caused by vibration of the stiffened ventricular wall, when the blood is pushed from the atria into the ventricles. The next phase of the cardiac cycle is the isovolumetric contraction. On the ECG, this phase begins with the appearance of the QRS complex, which represents ventricular depolarization. Ventricular depolarization is followed by ventricular contraction. When ventricular pressure exceeds the atrial pressure, the atrioventricular valves close, producing the first heart sound, S1. At this point, the atrioventricular aortic and pulmonary valves are closed, so the blood volume within the ventricles remain the same, or isovolumetric. Contraction of ventricles rapidly increases ventricular pressure. At the same time, there is a slight increase in the left and right atrial pressure because the increasing ventricular pressure makes the atrioventricular valves bulge into the atria. This increase in the atrial pressure is termed as the C wave. The aortic and pulmonary valves open when the pressure within the ventricles is higher than the pressure within the aorta and pulmonary arteries, causing rapid ventricular ejection. During rapid ventricular ejection, there is a sudden ejection of a large amount of blood from the ventricles. When the left ventricle ejects the blood, the pressure from the left ventricle is equally transmitted to the aorta. At the same time, the volume of blood in the left ventricle decreases quickly. On the ECG, rapid ventricular ejection matches the ST segment, which represents the period between ventricular depolarization and ventricular repolarization. When the ventricular pressure decreases, and the atrioventricular valves return to the neutral position, the pressure within the atria decrease, which is noted as the X descent on atrial pressure curve. Atria start to receive blood from the lungs and systemic circulation. The fourth phase of the cardiac cycle is reduced ventricular ejection. On the ECG, This phase is marked by the beginning of the T wave, which stands for ventricular repolarization. During this phase, ejection of blood is due to inertial energy of the blood, not by ventricular contraction. Ventricular pressure and aortic pressure start to decrease. The volume within the ventricle gradually continues to fall, because the blood is still moving out of the ventricle but at a slower rate. Within the atria, the pressure starts to increase, because they continue to receive blood. Then ventricular relaxation begins. On the ECG, the start of ventricular relaxation is marked by the end of the T wave. From this point, there is no ECG change until the next cardiac cycle starts. Since ventricles are relaxed, ventricular pressures decrease. When the aortic pressure is higher than the left ventricular pressure, blood starts to flow backward toward the heart, resulting in a small dip in aortic pressure graph, called the dicrotic notch. The aortic valve closes when the left ventricular pressure falls sufficiently to prevent the backflow of blood, producing second heart sound, S2. The aortic valve closes earlier than the pulmonary valve. There is a small increase in aortic pressure, due to the closure of aortic valve and elastic recoil of the aortic wall. At this point, atrioventricular valves, aortic valve and pulmonary valve are closed, and there is no blood entering or leaving the ventricles. The volume within the ventricles remains the same, and termed isovolumetric ventricular relaxation. The atria are still filling with blood, and the pressure within the atria gradually increases. This can be seen as V wave in the atrial pressure curve. The volume of blood within the ventricles remains the same, until the ventricular pressure is lower than the atrial pressure. When the atrial pressure exceeds the ventricular pressure, the two atrioventricular valves open, and the two ventricles start to fill rapidly with blood from the atria. This phase is called rapid ventricular filling. The opening of atrioventricular valves leads to a rapid fall in atrial pressure, noted as the Y descent. Rapid filling of the ventricle may produce the third heart sound, which can normally be heard in children. In adults, the presence of the third heart sound may indicate volume overload or ventricular dilation. The last and the longest phase of the cardiac cycle is reduced ventricular filling, also called diastasis. During rapid ventricular filling and diastasis, the ventricles passively receive about 90% of the blood, while the remaining 10% is received during the first phase of the next cardiac cycle, or atrial contraction. During ventricular diastole, the aortic pressure continues to fall. When the sinoatrial node triggers the electrical impulse, the atria depolarize and the next cardiac cycle begins. I hope you enjoy this video. Thank you for watching this video. Stay safe and healthy.